What diabetes is, it's a metabolic condition that involves regulating blood sugar levels, and most diabetics have a problem in that their blood sugar level is too high. And what this does over a long period of time, it affects the circulation throughout the body. Actually, what diabetic retinopathy is, it's the way chronic high blood sugar levels affect the eyes. And what happens is that new blood vessels can grow in the back of the eye, or you can get leaking and swelling in the back of the eye. Leaking and swelling can cause a loss of vision or blurry vision. And if new blood vessels grow in the back of the eye, these blood vessels tend to be weak and prone to hemorrhaging, and that really can cause dramatic vision loss. The way diabetic retinopathy is treated, first of all, the most important thing is to have at least an annual eye exam. The purpose of that is to diagnose whether the person does indeed have diabetic retinopathy. In its mild stages, diabetic retinopathy just requires observation. If it starts to progress and cause swelling in the back of the eye, sometimes laser treatment is needed, and this is sort of the mainstay treatment for diabetic retinopathy. Little focal areas of laser treatment can help reduce swelling and help vision. If new blood vessels start to grow in the back of the eye, a more extensive laser treatment called pan-retinal photocoagulation is performed. And what this does is it decreases the need for oxygen in the back of the eye, and it makes those weak blood vessels go away. So it's to try to prevent hemorrhaging in back of the eyes. The most important thing with diabetic retinopathy is to manage your blood glucose levels. Regular follow-up with your primary care physician or your endocrinologist is a must. The better the blood sugar is controlled, the less likely that you'll have complications from diabetes, such as diabetic retinopathy. After having laser treatment for diabetic retinopathy, actually there isn't much as far as the recovery goes. Vision might be blurry temporarily, but the patient basically goes about their normal business. And the main thing is to make sure the patient makes their follow-up appointment with the ophthalmologist to make sure the treatment is going well and that the eye is healing. But there are really no restrictions after having laser treatment for diabetic retinopathy. Follow-up exams are actually a must. That's the most important part of monitoring diabetic retinopathy. You can't cure diabetic retinopathy, you can only control it. And the idea of laser treatment is to try to calm it down and control it so the condition doesn't get worse. You may have some laser treatment, and at a later time you may need more laser treatment. So it's a progression. And as I can't stress too much that managing the blood sugar levels are the most important thing to try to prevent the condition from getting worse. Quite often a patient would not know that they actually have diabetic retinopathy. A thorough eye exam is how the condition is diagnosed, and in its early stages it usually doesn't cause any symptoms. As it progresses, the vision may become blurry. So blurry vision would be an indication that something's going on, but it means that you require a thorough eye exam to find exactly what's causing the problem.